efforts are geared towards uh, reducing the likelihood of child abuse and neglect so that the likelihood of children entering the system is reduced considerably. While the system improvement plan is geared towards strengthening our child welfare system, it's about strengthening its capacity and capability so that in the likelihood of children when they are in the likelihood of child abuse, neglect, and they entering the system, we are able to provide them with best possible services possible and we can ensure their well-being. The CPP, the Comprehensive Prevention Plan, is a lot about engaging communities, actively participating with community members, community partners, the various stakeholders. There is a lot of work going on with AB 2083. Systems of care and so forth. And the purpose of that is so that we have that collective sense of responsibility and ownership to safeguard our children, to ensure that the families are empowered. And so that, again, we want to make sure that the kids are thriving in a great environment. The system improvement plan then supports that in case of any crisis, we are providing the best possible services. And now, and Dawn is going to speak more to the strategies that we're going to come up with so that there is a reduction in likelihood of any repeat maltreatment, so that we make sure that we achieve permanency. We help children get reunified with their families. And once that happens, then again, we go back to the prevention team. So then they provide that support so that once that reunification happens, the kids are not coming back into the system and we are creating a kind of a system independence. So when prevention is going to prevent the kids a likelihood of coming into the system, if they come into the system improvement plan is going to make sure we're giving the best services and we're helping kids achieve that reunification with the families. And once again, the prevention team will be working together with so that we make sure that those kids are not coming back into the system and we're providing that entire circle of care in a very comprehensive and a very holistic manner. So together, these plans in alignment will help us improve our child welfare outcomes of safety, permanency, and well-being. And I do want to add that under the leadership of Damien Wright, our new director, and the entire executive team, the collaborative leadership of our senior leaders, our staff, we are also working on developing a strategic framework, which is not only going to just align the comprehensive prevention plan and the system improvement plan, but will also create more synergy with our other efforts like the racial equity plan and various other projects that DFCS is currently working on. And I would like to then, invite all of your continued partnership and engagement as we work together towards safeguarding our children so that we can provide them with the best care today so that they may thrive tomorrow. And with that, I will pass it on to Wendy back so that she can share more details of the comprehensive prevention plan. Thank you.
Thank you, Naveen, for setting the stage for that. So the first presentation that we have for you, I'm happy to invite into this space our senior leader, Rocio Abundis, who serves as our senior leader over all of our prevention activities, as well as our voluntary services, and Katie Hubner, who has been one of our key leaders as a senior management analyst in our work for our comprehensive prevention plan. Next slide, please. And with that, I'm going to invite in both Rocio and Patty to lead us in this. These next few slides are really going to take you through the work that Santa Clara County is doing in partnership with the probation department. We are an opt-in county, both for child welfare and probation, and are excited about this opportunity to expand our partnership with community, specifically focused in on needs that all of you have lifted up in community. With that, I will pass to Rocio.
Good morning. So thank you for having us again to recap where we are with the plan. Excited to say that our 3-year prevention plan has been approved by the state. Yay. So that's super exciting. And wanted to just reemphasize what Wendy said, in that this is a partnership, not just with probation, but other system leaders, County Office of Education, Public Health, Behavioral Health, and many others. A list too long to list out. And the reason why I wanted to reemphasize this is that this is a huge lift, and DFCS cannot do it alone. And so I just wanted to emphasize that we are doing it with others. I'm going to pass the baton to Katie Hubner to just talk a little bit about what the components of the plan are.
Thanks, Rocio. Leila, can you take us to the next slide? Thanks. Okay, so the core of our county's comprehensive prevention plan is our theory of change, which says that we will partner with families and communities to create networks of support, leverage resources, and create conditions where families and communities are healthy, safe, and thriving. That's a lot. This is a multi-year plan after all, but it's really organized around 5 key objectives that we think are going to take us a long way towards achieving that big vision. So the first one is really, the first objective is around service access and is around increasing service access to be more relevant to family needs. So this is really rooted in a lot of community engagement work we did, where we heard loud and clear that community needed several things, but most prominently more access to concrete supports, as well as more culturally relevant programming. And then we also needed to do more to make that programming accessible by rooting more services in community delivered by members of that community. We're also working on changing agency culture and really shifting from a culture of policing or mandating change to really supporting families to achieve their goals. And you see that in the work of the implementation of the integrated core practice model, as well as other family engagement work that we're doing. Addressing systemic disproportionality is woven throughout this work. It's in everything from the types of programming that we're emphasizing in our plan to the work we're doing around community engagement and really building up advocacy capability and pathways to engagement for those families who have been most disproportionately and historically harmed by child welfare and probation services. And it's in our, and you see that systemic disproportionality addressed as well in our CQI and evaluation strategy, really taking a hard look at whether or not any specific communities have systemic barriers to engagement or success in our programming, and really preparing as a collective to address that. When we talk about establishing sustainable infrastructure, our fourth objective, we're really talking about looking at those systemic challenges that sometimes undermine these efforts. So that's really about taking a hard look at how we are building up our staffing pipelines, how we're ensuring sustainable funding, and how we're building capacity with our community partners so that we can work together to achieve those advocacy and engagement goals. And then finally, when we talk about utilizing CQI and feedback loops to ensure accountability, we really are working on building evaluative capacity to understand if we are successfully engaging families in the ways in which they want to be engaged, and whether or not that engagement in the services we're providing are working to improve protective factors for the families. In short, if we're really leaving them better off and more equipped, more resilient to address the daily stressors and to be thriving members of their communities. So with that, I'm going to pass it back to Rocio, and we're going to go to the next slide.
So, Raul, just to answer your question, there was significant stakeholder input in this process, but I also want to say that the stakeholder input is not an endpoint, and that is something that we're going to continue to strive for as we try to develop our implementation plan. Our priority population was developed not just through stakeholder input, but also looking at all of the needs assessments that had been done in the county in the recent couple of years. We looked at approximately 40 to 50 assessments to come up with some draft populations, and then we vetted it with our oversight committee, which includes different folks from CBOs to folks with lived experience to our key stakeholders. And our priority population is really about servicing the children that are at most risk of harm and neglect. And specifically, we're looking at families and youth that are struggling with substance abuse, pregnant and parenting foster youth, homeless youth or their families, and families struggling with domestic violence. So those are our priority populations. That doesn't mean that we would turn anyone away, but this is where our focused interventions will be. Next slide. I want to also emphasize, we usually talk about how we support families that are in our system and how do we successfully exit them out with support. And this plan is really about a broader system, and that is primary, secondary, and tertiary prevention. And primary, what that means is serving community in community. This is a general population, and if they have a need, we can support their need and keep them from ever having to enter the system. Secondary prevention is really about intentionally working with those communities at risk of child abuse and neglect. And so there would be a targeted intervention in supporting that group. And tertiary prevention is for those that are already system involved, and how do we support them while they're in the system, and how do we support them when they leave to have the proper care that they need. So what we wanted to do was give you a scenario. What does this look like in real life when we implement it? We won't have time to go through all three scenarios of primary, secondary, and tertiary. We're going to just focus on primary and what that looks like, what that will look like on the ground when we implement. So next slide. Oh, this looks different. So really what this is about is, again, primary is servicing the general population, making sure their needs get met in community. And really what I want to focus here are some potential strategies for serving this group that we're looking at through this plan in particular. One is there was an identified need to support fathers, specifically in the area of substance abuse, and making sure that they have the supports they need in terms of residential programs, as well as just parenting support. Also lifted up was the need for home visiting programs. So we're looking at launching home builders, and then the need for parent education and parent navigation. And so these are some examples. It's not that this is what we will be supporting. Some of these activities already exist in the county, and some would need to be brought in. And then motivational interviewing and the other programs that are listed there. So these are some examples of strategies that we'll be looking at to implement in this plan. So next slide. So what would this look like in a scenario? So I'm going to just kind of recap some of the situations here. So if a mom were to enter into a family resource center, she identifies the need for food and diapers. And while she's there, she takes advantage of the opportunity to say, hey, I also need help with my water and electrical bill. So in the assessment, it's discovered that mom and dad have limited education, and they're both working part-time, struggling to make ends meet at just $15 an hour. There is mental health issues. The mom struggles with depression and suicide. The dad struggles with substance abuse and also parenting challenges. There's domestic violence in the home. Parents are fighting physically, and mom has ended up in the hospital. And then the youth are really impacted by what's going on in the home. The oldest, which is 9 years old, is struggling with their grades, attendance, and behavioral issues. Lily, who's the 5-year-old, has developmental issues and unique needs that aren't necessarily being met. And the youngest, which is just 1 year old, Mimi, is also having challenges in the sense that there are physical signs of possibly abuse and showing bruising as well. So what would this look like in terms of applying the primary prevention strategy? So next slide. So what this would look like is, while they are at the FRC, any FRC, there would be somebody who would do an intake and an assessment to determine what are the risk factors that are appearing with this family. And I already listed most of them out. And they would determine eligibility. And then in the process, they would develop a plan, a comprehensive plan with the family. So it's not a provider doing it for the family. And they would identify what are the supports that they would need to address the risk factors that have been identified. And they develop a case plan. And what is important about this primary prevention is that the family's partnering with someone who is not system related. It's not DFCS, it is not probation. So there's likely to be greater trust in that scenario. The services are voluntary, and because the family's involved in the development, they're likely to continue on with the services. So that's what's really important here. So a plan would be developed, and then they would be referred to services through a warm handoff. Next slide. And what does success look like in this scenario? The family would receive the supports that they need, resources to address their stressors and to prevent involvement with the system. That's what success would look like. And the warm handoff is really important. It's not just here's the phone number, but here are the services that are available to you and helping that family get connected with those services. So I'm going to pause there and allow Katie, if you have anything that you wanted to add to this scenario and what this would look like that I may have missed or you want to emphasize.
Nope.
Yes,
nothing
sorry,
to add.
Darlene, if I used acronyms, sorry.
No, in fact, I think we can move to the next slide.
Okay.
Um,
And if there's acronyms that are used, sorry, we do slip and say them. I try really hard not to. Please put it in the chat and I'd be happy to spell it out if we missed it. Okay, go ahead, Katie.
Thanks. Yeah. So the goal with secondary prevention is really for those families who have those more complex needs to really ensure that they are being engaged and receiving the resources that will build their ability to address those family stressors. And the focus here is really making sure that they have access to those more intensive services and case management, but where possible, really offering those services in community and reducing any traumatic involvement with systems. And so can we skip ahead 2 slides? So go ahead, one more. So the process for a family who's in secondary prevention, that secondary prevention tier is not that different from primary. That family might be identified by a community provider. They might have been referred to the Child Abuse and Neglect Center and gone through a CPS investigation. But the idea is still the same, which is that as long as that child or children are still safe at home, we maintain the family as a unit while providing them case management and service access, and preferably services that are rooted in community and can help build their long-term resilience and well-being. And so the process is similar. We would ideally connect them to a community provider who can work with the family to build a prevention plan and provide that case management. Or for more intensive cases, they may go through our voluntary department and be routed through voluntary. But the focus is still on maintaining the family as a unit while helping them build resiliency and protective factors so that they can stay together before any of the children become unsafe and do encounter that harm or maltreatment. And so can you go forward one more slide? And success is the same, right? The family is thriving, the risk factors are being addressed, the family has tools to continue addressing their risk factors in the long term, and that in that 1 to 2 years post that initial engagement, that they are still together and that they are still thriving and accessing supports when they need them, but without any formal system mandate. Next slide. And then, as Naveen said, prevention work does extend into this tertiary tier, and it does overlap with that system improvement work that we'll be discussing in the next few minutes. When we talk about those families who are already formally system involved, so those are the families where the children have possibly been removed out of home care or become formally involved with juvenile probation, we still want to mitigate the trauma historically associated with system involvement. And really that's around good family engagement and partnership, as we will see expressed in the integrated core practice model. And it's around making sure that we can address those service gaps, that families are getting access to the therapeutic supports they need, as well as we're increasing those aftercare supports so that when the family comes out of care and they're back in their home environment, they aren't just immediately dumped back into those same stressors they were encountering before they came into care, and that we're really equipping them with those natural supports and those access to, say, concrete supports or therapeutic needs or whatever it is they need to be able to transition back into their daily lives and really continue to build their toolbox around addressing stress and mitigating conflict. Can we skip forward another 2 slides? And so in this example, a family has reunified and their case is closed, but some stress has shown up. And they might get referred out to a community provider for post-reunification services that can, say, help them address our child came home, but now he's entering, say, maybe his teenage years, and he is acting out, and we're not sure how to deal with it. These aftercare supports will connect them to either the wraparound services or therapeutic services or differential response services they might need. And together with that community provider, they can develop a case plan to really build out the list of services and resources needed and begin addressing those stressors. And, you know, ideally stay together as a family, weather these challenges, and not have that repeat involvement with the child welfare system that we have sometimes seen in the past. Next slide. And again, success is stable and thriving families with minimal DFCS or probation involvement 1 to 2 years after case closure. So we have different strategies that are really tiered out based on our expected needs of families relative to where they are on their involvement with the system. But the end goal is the same, which is stable and thriving families who have the tools they need internally to address their stressors. And I think with that, we will transition to the next slide and to questions. We have about 8 minutes allocated to questions, so please don't be shy.
And Wendy, if you wanted to add anything, you're welcome to add anything as well.
No, I think you both did a good job. I just reiterate that this is meant to be a work in progress. Some of the things that you will see coming forward is making sure that this is a live document. And as we get feedback, both with regards to programs that are working, we shift and do more of that. If we need to add programs, we're adding that. This is meant to be a work in progress plan in partnership with probation, in partnership with community, and in partnership with our other partners. I'm scanning chat and not seeing anything. Anyone in the audience with questions, if you want to unmute or raise your hand.
Bro?
Yes, I just wanted to see if it's possible to get a copy of the community stakeholders that were invited to participate and those that actually participated, which may be a different subset. Thank you.
Sure. I will say we have a list. I will say that participation is not the same because we tried to meet stakeholders where they were at. So participation wasn't limited to those stakeholders who could attend planning meetings. We also did our best to attend the meetings that they were holding and be part of their space rather than forcing them to come to our space. So that meant presenting, say, with the multicultural community team, presenting to the REAL team, which is our race equity and alliance team. We also went out to some of our different neighborhood family resource centers and presented to the community advocacy groups there. And then we invited anyone who had attended any sessions or received any presentations to join those meetings if they were able, but we also provided them with copies of the plan so that they could provide feedback. And we created a newsletter. So, and there's 2 different newsletters depending on whether someone is part of a formal system, meaning that they're a government partner or a community-based organization versus community. And that was really around making sure that we were using user-friendly language. And we are, as Rocio said, this is not a one and done process. So we are also have as a key tenet in those objectives I went through earlier, really building up community engagement capacity and really building strong pipelines for dialogue, not this historic norm where an agency has a need, so they set a meeting and ask for feedback in the context of their needs, versus really investing in our advocacy capacity to community level and trying to figure out how we can build a space where community can set the meeting and community can petition to bring needs to either us as the planning team or the broader system of care. So we're happy to provide that info, but I will caution that trying to do this work well has meant that it's complex and layered, and it doesn't always translate to like a nice, neat one pager.
Yeah, we also met with other existing groups like the South County Youth Task Force. We met with smaller groups, youth groups that we had connections through probation and our hub. We did a lot of one-on-one individual stakeholder interviews with people who were content experts to ask for their thoughts. We started a new group. I'm not sure what we're calling it. It's a group of Native American stakeholders. So this is going to be an ongoing, evolving process because we need to be responsive and be able to shift as new needs come up. And the only way we can do that is by keeping our ears to the ground. Wendy?
Yeah, thank you, Katie. And Rocio, I'd also say that we actually put into our plan that this is an area that we want to do better and more in. So we've developed a pretty comprehensive list of all of the groups that already exist within the community, tethered to child welfare and probation, both with regards to youth, parents, caregiver, with both language and cultural considerations, communities within communities, so that we can make sure, as Rocio and Katie both said, that we're going back to the source of those groups to make sure we're building out as needed in those areas. So we'll be happy to make sure this is a piece. If you're interested, we let you know what's going on.
Any other questions or follow up on that topic? I know that that's a hot topic. It's an area where we're really trying to grow as a collective. So please feel free to expand or challenge us. You know, this is a learning process, which means we can't just plan it and be done with it, and we can only learn through the feedback. Rebecca?
Hi, Rebecca Luna from the Prevention Bureau. I think it's just a general comment. It's not a question, or maybe not so general, right? But taking into consideration our Indigenous families and communities and our stakeholders, I just wanted to say some of these meetings are ongoing, right? Like Rocio and Wendy have mentioned, this plan is continuing to develop. And for some communities, it takes a lot longer to really build trust, you know, in the system. So I can at least attest, right, for some of that work that's going on with getting feedback from the community and continuing to work on prevention, at least for us, for Indigenous families, but Justo and Marisol are heavily involved as well, and just trying to, you know, build a bridge with a culture that is used to, you know, boarding schools and multiple generations of system involvement. So it's ongoing. The work is there. But it should be more than just analysts and supervisors and managers attending. You know, we also need line staff attending these forums and providing that feedback as well.
Thanks, Rebecca. Absolutely hear that. And thanks for also acknowledging that go slow and lean in to build bridges that was needed in our work with our Indigenous persons and our Native American and tribes in Santa Clara County to slow down and do that. And your points about line staff is noted. I think we're trying to really partner and lean in more to our work with REAL and all of our affinity groups, but we'll lean in further if we have any misses on that.
And I just want to share a story that I think is actually kind of cool. So we submitted our initial plan and we got a little bit of pushback from the California Department of Social Services around, hey, did you check these boxes in the way we wanted you to check these boxes with Native American and Indigenous engagement? And we went back and we talked to our team that has really been working on that. And they pushed back and they said, listen, we are moving at the pace that this community is ready to build trust. And we are centering what they want to talk about and how they want to show up at this space. And we will work in the CPP compliance concerns as we can, but we are not centering the systems needs. We're really trying to center the community's needs because that's what it means to build this relationship in an authentic way. And we worked with them to really write a formal response that we sent back to CDSS, and CDSS said, great, fine. They backed off. They approved our plan, obviously. So there is a commitment all the way up to the state level to try to do things differently. And sometimes like bureaucratic compliance norms rear their head because it is historically our culture. But when we have pushed back and when we have really worked with the staff who are trying to do that change and make these like thoughtful responses about here's our intention and here's how we're acting out on that intention, we've been getting support. We've been getting support from senior leadership within DFCS, and we've been getting support even from the state with a little bit of nudging. So there is some change happening. It sometimes feels invisible for those of you at the front line, but I thought that was a really great example of us as a county really trying to practice what we've been preaching about centering community needs versus centering compliance and state-driven needs.
So
All right.
I think we're at time. So open to more questions if you want to throw them in chat, and certainly you can reach out to us as well.
Yes, there is a question in chat. If you can go ahead and answer it in
Okay.
there. I'm going to go ahead and move us to our next presentation. Next slide, please, Layla. And we are covering the system improvement plan. So I think, Don, you are starting us off.
Thank you, Nora. Thank you, everybody, and welcome to today's community forum. Good afternoon. So I just want to start off by saying that, we've done a lot of great work with our CSA and SIP plan, and I'm excited to share the goals and strategies that our county will be focusing on. Prior to discussing the work that we are doing, we want to provide the framework of the California Child Family Services Review to provide understanding of why we do the CSA and the SIP. And how we do it in order to ensure that we are safeguarding our children, empowering communities, and strengthening children and family systems. Our vision is to, so I'm moving my notes around. Our vision is that we provide the best care today for our children and families to thrive tomorrow. And in a lot of ways, like, as Naveen has set up the connection earlier, there's a lot of connection between what we do within the system and a loop back loop to prevention, both the upstream as well as the transitional prevention services afterwards, after families leave our system. So with that, if you go to the next slide, please. So today's presentation will provide an overview of the California Children's Family Services Review, the CSFSR, and its process and its purpose, along with the discussion of the CSA and a SIP, including our goals and strategies of both DFCS and probation. Well, we're not going to go through probation. The time period that it covered was so our current SIP plan is covering 2022 through 2027, but our CSA covers the period of 2017 through 2022. Next slide. And I see in chat that Elizabeth can't see the slides. Is anybody else having the same problem?
No, we can see the slides. So Liz, you might want to go get the slides or leave and then come back and see if that helps.
Okay. So this slide kind of describes the whole process. It's actually a continuum, right? It starts with our county self-assessment and peer review. And the information there is to help guide how we're doing and how we could do better. And that feeds into the system improvement plan, where it helps us to create and as well as develop planning on how and what we need to do to strengthen and improve, as well as action steps that we can take to improve, and how we know we will be improving in those areas that we identify. And then the next phase is really the implementation of it around improved safety, permanency, and well-being. So basically, we want to act and implement what we describe and work together towards improving our services and outcomes. Next slide. So for this particular one, our CSA began in 2017, and it included a number of stakeholder focus groups completed in March of 2022. We started working with a CSA around early of that, prior to that, in developing the framework and conducting a lot of recruitment. So as part of the process, we recruited peers from other counties so that they can look at our cases and really provide thoughtful feedback. Currently, our CSA has been approved by the state, and we are all working to finalize the sub-plan. So we had a draft that was submitted early in the year, and we provide a couple of rounds of feedback or clarifications from CDSS. So part of the CSA included quantitative analysis that was conducted through a very rigorous data analysis. There's review of data from the California Child Welfare Indicator Project, housed at UC Berkeley, and that was conducted. We reviewed all federal measures and data over the last 5 years, covering the period of 2017 through 2022. And that's all the qualitative analysis. So we had stakeholder engagement that I talked about. There were a number of stakeholders, including parents, youth, resource parents, employees, and other stakeholder groups, and county employees to help in that analysis. In total, we had representatives from child welfare, probation, service recipients, county agency partners, and so on. And that was conducted over a period of 7 days, looking at our P1 and P4 indicators. P1 is permanency within 12 months, and P4 is re-entry 12 months after dismissal. And I'm also going to lean in with Naveen as my co-presenter. I forgot to introduce her and acknowledge that she's going to help to fill in the gaps if I left anything out. So I want to pause there if Naveen, if you want to jump in on anything.
Well, thank you, Don. The only thing is, like, as Don just mentioned, that, the county self-assessment is actually looking into how are we doing and what can we do better. And to get those answers, we did a very rigorous data analysis to identify where are the gaps in our services and what needs to be done. But then this was also provided with a qualitative analysis, because numbers is the beginning of a question, but the context is answered by the qualitative information. And so we did that through peer reviews. So we had 9 counties that we had reached out who participated. We reviewed 27 cases, and they were at least, I know in the CPP, one of you had asked about how many stakeholders. So in our case, we had 35 stakeholder representatives from various departments and community forums, as Don mentioned, from the youth groups as well. And based on this analysis, we had our key findings. Can we please go to the next slide? So these were our findings, and I will let Don speak more to it. But the key thing that I would really want to bring everyone's attention is that in those areas where we have a sphere of influence, those are our strengths. And the opportunities of growth are in those areas where we cannot do it alone, where we need collaborative partnership with other departments and the community. And with that, I will give it back to you, Don, to speak to our strengths and opportunities, the findings.
Thanks, Naveen. So just to clarify, the counties that Naveen mentioned, we had San Mateo, San Bernardino, Yolo, Contra Costa, Orange, Fresno, San Joaquin, and Butte County representing child welfare. And for probation, we had representatives from San Mateo, San Bernardino, and Yolo. The reasons why we chose those or invited them is that, you know, they had expertise around the indicators that we wanted to measure, and that their populations also in some ways mirror and reflect what we have in Santa Clara County. So our strengths included the fact that we had low caseloads, allowing for youth and family engagements. You know, as a kind of a framework or a baseline, in the early 2000s, our caseloads were as high as 30 children, and you know, with our most recent CSA, our caseloads as a what was agreed upon is between 16 and 18 children. And so we had, you know, much lower caseloads than that actually, because that's just a cap. The other strength that was identified was that through initial placements, Santa Clara County did pretty well in terms of making sure that children are placed with their siblings in out-of-home placement, and that we use CFTs and warm handoffs on a very regular basis at every major decision points that we can. The peer review and others also identified that we have very extensive worker experience and education. Many of our child welfare staff have anywhere from 5 to 20 years of direct child welfare experience. And education-wise, the vast majority of our workforce have master's degrees and above. We also have an increase in number of specialized placements during that time period that was assessed. In that there is also an increased number of services available for Spanish-speaking families, and that trainings integrate into practice. You know, everything that we've said we want to do, as well as focusing on, we were able to provide very integrated trainings. That being said, they also identified areas of opportunities, matching placements with needs of children for specialized treatment needs for more of a, you know, we also result in out-of-home, well, out-of-county placements. The reality is we don't have many short-term residential treatment programs locally within the county. And that's just a structural issue that that many other counties are experiencing alongside Santa Clara County. So that resulted in out-of-county placements for some of those more specialized treatments. We continue to experience obstacles to maintain connections between family due to lack of transportation, and that's something that we continue to work on. And then homelessness and connecting unhoused families with services through stable shelters has been a consistent challenge. And then the last opportunity for growth is really around absences of substance abuse treatment program for youth and support services for developmentally delayed clients, inaccessibility of RAP and therapy services, and too many Spanish-speaking providers, too few Spanish-speaking providers to reduce long wait times for services where it was identified. Next slide, please. So this slide describes what we're focusing on. The guidance from CDSS is that they wanted to make sure that we only focus on 2 to 3 priorities. And so as a department and county, we felt these were the most highest priority. So S2 is the recurrence amount of treatment within 12 months of a substantiated allegation. And so the indicator or the area that we want to move towards is really, as you know, numbers as low as possible, right? So in Santa Clara County, our numbers are 6.1% of recurrence of maltreatment, meaning a new referral coming in 12 months after, or within 12 months. For California, that measures 8.3 as a standard, and the national performance indicators is 9.7%. So Santa Clara County is doing really well in terms of recurrence of maltreatment. And the reason why we keep this is because it's a if you want to call it a canary in the coal mine, right? It helps us to kind of keep tabs on how we're doing in other areas. Recognizing that if we are seeing an uptick in new allegations, it's telling us something. Even if we are continuing to do well in this area, we don't want to have any backslides. Second area that we're looking at is the P2 indicator, which is permanency for children in care between 12 and 24 months. This is just recognizing that as we're experiencing more high acuity families in our systems, that we need to provide more bandwidth and time for them to be able to achieve permanency and really achieve their goal plan, case plans. So our current performance indicator is at 40%, whereas the state is at 43.2, and the national performance indicators 43.8%. So the area where we want to improve on is really increasing that number. So as the state is showing, we still have some growth in terms of being able to reunify families and achieve permanency for children within that 24-month period. Our last priority that we're focusing on is the re-entry into foster care. And again, you know, as the arrow's indicating, we want to have lower numbers in this area. So Santa Clara County, we're at 7.6%. State as an average is performing at 8.1. That means all counties in California are performing at 8.1. So we're doing better than the state, but it's still not meeting federal benchmarks that we're trying to achieve, which is at a 5.6%. So we're trying to prevent more families from coming back into our system. Next slide, please. So again, you know, with CDSS, the guidance was to keep the number of strategies to within working reason. So we chose 4 areas. First one is increasing linkage to differential response diversion and aftercare services to prevent recurrence of maltreatment and re-entry into the foster care system. That kind of links directly back to the CPP, right, with the upstream prevention as well as aftercare prevention efforts that that plan was describing. We also want to focus on building natural support networks to create stability throughout the life of the case as well as post-reunification. That links back to a lot of our use of CFTs and other trainings. And then also using improved or having improved use of data and SDMs, structured decision making, around all of our decision making points. And then lastly, it's really integrating, having more integration and better leveraging of our safety organized practice through retrainings and just emphasis on both SDM and SOP. So I know we're kind of short on time right now, and so I'll just leave it there and leave it up for questions. And Naveen and
Don, there
there's
is a
a
question
hand
on
raised.
specialized placements. I was wondering if you can speak to that. The question is, what types of specialized placements have been added that contribute to increase? So if you could speak to the placements.
Sure, I think just a lot of creative use of identifying the needs. So it really starts with that engagement, right? And I think we're doing to really understand the needs of our youth and having those CFTs identify what are the opportunities. There's a lot of use of complex funds to identify how we structure it, you know, use of professional family homes, everything we can do to help support families and relatives in terms of their ability to take on placements. But at the end of the day, it's also looking at partnering with SARC and behavioral health and others around those short-term residential programs. And there's a lot of engagement that happens behind the scenes to work with a system of providers. So I don't know if that answered your question specifically. I think one other point to make is that the number of kids that we have in care has really declined over the last 10 or 12 years. We went from a high of several thousand kids in at-home placement down to about 500 children, including those in long-term permanent plan placements. And those that we do have are also experiencing a lot higher acuity needs than we typically had in the past.
All right. Thank you. I think we've covered any questions. If anyone has further questions, please do put them in chat and they'll be answered in there. So mindful of our time, we have about 3 minutes left. Go ahead and flip to the next slide. Okay, next slide. All right, I'm going to put in the link for the survey on to get your feedback on this community forum. I'm going to go ahead and put that in the chat. If you can take that quick survey, we would appreciate it so that we have guidance for the next time that we do a community meeting. But I will open it up. Are there any quick questions for our execs?
Nora, I've tried to get all the questions in chat, but if I missed anyone from anyone, please feel free to raise your hand if we missed anything.
I think there was just one on the definition of substantiated abuse, and that means is that there is enough evidence and it meets the criteria that has been set about abuse, and that's what it means. And other than that, there has been no changes, as Wendy mentioned in the chat.
Thanks, Naveen. There was also a question about our types of placement and if that's changed. And just noting that Santa Clara County has continued to build out our intensive treatment foster care options in partnership with our foster family agencies. So ensuring that our highest needs youth are in placements of 1, no more than 2 at any given time. So that continues to be our focus here in Santa Clara County, knowing that we don't have any of the short-term residential treatment programs here. And we want to ensure that children and youth can remain in this county, close to family, close to reunification. So that's been our priority.
All right, we have a question in the chat.
So to that, Ayana, the thing is, yes, the goals are in terms of the outcome indicators, because we are supposed to say which federal outcome indicators we are going to refer to. But then when you talk about strategies, especially the action steps and the targeted population, that is very specific.
So one thing I do emphasize around Ayana's question is that the SIP plan is not describing everything that we're doing. Obviously, we're doing a lot more than what we're identifying. It's just a requirement of the SIP and the guidance from CDSS that we focus on a few key indicators to focus on. Looking at the comprehensive prevention plan, obviously there's a lot going on, and there's a lot of other things that's taking place that we're not describing. Around placement, Gilbert could probably talk more about this, but we are looking at developing something called a Mockingbird hub model, where we're creating more of a different kind of support system for placement, and really leveraging the expertise of resource homes and how to organize and focus on supporting a child through placement and through a small constellation of teams. But I think, the point is, we're open to ideas and really looking at strategies that are outside the box. We may not be describing everything within the SIP, but we definitely are open to many different approaches.
And there's one more question in here. What counties were used for the quantitative part?
So it's a quantitative analysis is basically looking at our federal outcome indicators and doing a deeper dive and analysis and a root cause analysis that is done by us, by the CQI team. And it is the qualitative where we want to know more about the context and have an objective review of the cases that we are doing. So we invite the peer counties to do that peer review, and then we also have the focus group and stakeholders. So quantitative is completely done by the CQI team. The qualitative has stakeholders and peer counties involved.
And a lot of that data is available at the UC Berkeley website for the child welfare indicator projects. Everyone is able to go on that website and just pull the data for Santa Clara County as well as any county in the state. So if you have curious about it, you can go there.
All right. Over a little bit, so let's go ahead and close up. I'm going to invite one of the assistant directors, to go ahead and close us up.
Thanks, everybody. It was a very great, lovely discussion. So again, if there was anything that we weren't able to get to, please put it in the chat and we'll be more than happy to address those questions that come in. But thank you all for joining us today, and hope this forum was informative for you. And have a great day, everybody. Thank you.
Nora, I'm going to put in chat for questions, who for the SIP and who for the CPP. I'm going to put that into chat.
Nora, are we able to copy the chat somehow?
We are not.
Okay.
They don't make it like Zoom. So if you want to go back and capture it, you can do it yourself manually. We will be